stood alongside us as we brought back the Human Relations Commission, as we gave more authority to the Citizens Law Enforcement Review Board to investigate misconduct. You were with us as we created the Office of Equity and Racial Justice. We have taken some positive steps to do things, but we know that there is so much more that needs to be done. So before I turn it over to Supervisor Vargas, I want to acknowledge the individuals and groups who are with us today. Some of you will hear from in a few minutes. I want to thank Bernita Gutierrez, Vice President of Community and Government Relations, Planned Parenthood of Pacific Southwest. Diane Takvorian, my fellow Air Resources Board member, Executive Director of the Environmental Health Coalition. Layla Aziz, Director of Operations for Pillars of the Community. Angela Elliott Santos, Tribal Chairwoman, the Manzanita Band of the Kumeyaay Nation. Nora Chavez-Peterson, Executive Director of the American Civil Liberties Union, San Diego and Imperial County. Dr. Kira Green, Executive Director, Center on Policy Initiatives. Fernando Lopez, Executive Director, San Diego Pride. We also have the Latino Health Coalition, Black American Political Association of California, Chicano Federation, SEIU Local 221, Invest in San Diego Families, Alliance of Californians for Community Empowerment, API Initiative, and the countless other organizations that are fighting for racial justice and health equity who were not able to join us in person, but are certainly here in spirit. And so with that, let me turn it over to Supervisor Nora Vargas. And again, congratulate Nora on her election, on what she's doing. I am so excited and so thrilled to have such a powerful and strong leader on the Board of Supervisors, who I know is going to do terrific things. Supervisor Vargas?
Thank you, Chair Fletcher. It's a wonderful, wonderful opportunity to be here with you, and I'm excited about the work that we're going to be doing together. I want to thank everyone here today. I'm honored to be able to docket this letter with you next week. And with, I'm really proud that we have dozens of our community members joining us both here, but also on Facebook and so on, because it's really important for me that we reaffirm today our strong commitment to fight for equity and inclusivity in the County of San Diego. As our county has come together to really address the global pandemic of COVID-19, we have seen how it has disproportionately impacted communities of color. And we must also collectively recognize and address that the pandemic of systemic racism is in San Diego County and in our nation. This has resulted in, as you mentioned, discrimination and disadvantage in areas of housing, education, business, employment, criminal justice, and access to healthcare. And this absolutely demands our attention. In declaring racism a public healthcare crisis, we're establishing a commitment to disrupt and dismantle oppressive systems. And we take the necessary steps to make sure that we remove barriers that prevent diversity and equity and inclusion. And so this resolution is only the beginning, as Chairman Fletcher says. This is what our county needs right now to be able to make some transformational change in order to build partnerships with our communities where our most vulnerable communities need to be prioritized, feel heard, and feel safe. Our communities have been demanding action, and it is our responsibility to listen to our communities and create policies that are going to ensure our system works for everyone. What I'm going to do is just share with you a couple of the directives that we are moving forward to our Chief Administrative Officer that this resolution clearly dictates, which is create a process to solicit community input to identify county policies and practices that lead to or perpetuate racial or ethnic disparity with the goal of catalyzing change for just, safe, and healthier communities. Revive the statement of values, mission, vision, and strategic plan to represent equity and inclusion as a core principle of the County of San Diego Board of Supervisors, and incorporate a section titled Equity Impact Statement in the board letter template for all county departments to identify and determine a systemic approach with standardized guidelines to express the equity impact of recommended actions. We're going to enhance data collection capabilities to identify racial disparities among programs and services that are meant to improve health, social, and economic, educational, and criminal justice circumstances, and return to the Board of Supervisors within 90 days with an action plan to implement the direction above and identify the resources needed to achieve this request. This is an important piece because we wanted to make sure that, that we identify what that was. And so I do want to say que es un honor para mí acompañar al presidente de la Junta de Supervisores, el Supervisor Fletcher, y a docena de miembros de nuestra comunidad hoy que vamos a reafirmar qué tan importante es el compromiso que tenemos en la lucha por la equidad y la inclusividad en la comunidad. A medida que nuestro condado se une para abordar la pandemia del COVID-19, que nos ha impactado a todos de una manera desproporcionada, específicamente en las comunidades de color, debemos reconocer y abordar colectivamente la pandemia del racismo sistémico que existe en nuestro condado y que ha resultado en discriminación y desventajas en el área de vivienda, educación, negocios, empleo, justicia penal y salud. Esto merece nuestra atención y es un verdadero compromiso el que tenemos como condado para en realidad cambiar las cosas a largo plazo. Esta resolución no es solamente el comienzo. Nuestro condado necesita verdadero cambio transformacional para poder construir una mejor relación con las comunidades en donde nuestros más vulnerables tienen prioridad, que se sientan escuchados y se sientan seguros. Vamos a presentar esta resolución la semana que entra y le pido a mis colegas que nos apoyen. Tenemos la oportunidad de cumplir con las peticiones de la comunidad con un cambio significativo y duradero. Trabajemos juntos para construir un gobierno y un condado que funcione no solo para algunos, sino para todos. Los detalles de la resolución se los vamos a presentar también en nuestra página de web en español para que la gente tenga acceso. So the Spanish translation of our resolution is going to be on our website as well so that people have access to it and can distribute it as well. Thank you, Chairman.
Thank you. Thank you, Supervisor Vargas. Next, we're going to have a couple speakers here. We're grateful for every one of you and the communities that you represent. We're going to start with Bernita Gutierrez, Vice President of Community and Government Relations, Planned Parenthood of the Pacific Southwest. Thank you so much for joining us today.
Thank you, Supervisor Fletcher. Good morning, everyone. My name, again, is Bernita Gutierrez. I use she, her pronouns, and I'm the Vice President of External Affairs at Planned Parenthood of the Pacific Southwest. It is a privilege to be here in support of this important resolution. I want to just take a quick moment to congratulate former Planned Parenthood Vice President and current Vice Chair of the San Diego County Board of Supervisors, Norma Vargas, for her historic election, becoming the first Latina ever elected to the Board of Supervisors. We are immensely proud of you, Supervisor Vargas, and we look forward to working with you, Supervisor Chair Fletcher, and the entire Board of Supervisors on this and other critical issues affecting our communities. As a healthcare provider that works to increase access to high quality, affordable healthcare for everyone, regardless of income, race, sexual orientation, gender, or immigration status, Planned Parenthood is keenly aware of the disparities that prevent people from being able to access the healthcare that they need. Public health is built on the principle of saving lives. For too long, Black, Indigenous, and communities of color have experienced underinvestment and under-resourcing, leading to less access to healthcare and dramatic healthcare disparities. We see the results loud and clear in the ravages of COVID-19. Economic inequality, structural racism, and public health failures have translated to exponentially higher infection and death rates in Black, Indigenous, and Latinx communities. As our nation and our county confront the COVID-19 pandemic, it's morally imperative that we address the public health crisis that racism presents. For more than 400 years, the systems that built and have continued to uphold our society have demonstrated a disregard for Black people's humanity. The historical and ongoing experience of racism, discrimination, and racially motivated violence has severe consequences for the physical and mental health of Blacks and other communities of color. Even today, Black and Indigenous women are 3 times more likely to die from pregnancy-related causes than white women. The Centers for Disease Control and Prevention notes that most pregnancy-related deaths, over 60%, are preventable, and that they are due to a variety of contributing factors, including less access to appropriate and high-quality care, missed or delayed diagnoses, and lack of timely recognition and intervention of early warning signs during pregnancy and the postpartum period. In order to confront racism, we have to address inequities in maternal health and invest in increasing access to culturally concordant doula care, prenatal care, and maternal care. Racism, racial bias, and violence at the institutional and personal levels are at the root of numerous instances of reckless and abusive medical experimentation and neglect on communities of color. Even in California, there is a disturbing history of forced and coerced sterilization of women of color in medical facilities and in detention centers, and a long history of neglect for Black trans women in particular. A person's health doesn't just depend on whether or not they can access healthcare. It is also affected by low wages or unemployment, food insecurity, unclean air or water, homophobia and transphobia, less educational opportunities, and unstable housing, all of which are exacerbated by racism. Discrimination creates a barrier to health, both inside and outside the healthcare setting. As a leading healthcare provider and advocate for equitable access to sexual and reproductive healthcare, Planned Parenthood is proud to support the birth justice community, advocates, providers, and organizations doing great work day in and day out to address maternal health disparities and reproductive justice issues in San Diego County, including the work of the Black Infant Health Program, the County of San Diego's Perinatal Equity Initiative, Project Concern International's Healthy Start Program, for the Village Doula Services, and there are countless others. Planned Parenthood wholeheartedly supports this resolution declaring racism as a public health crisis, and we look forward to partnering with the county in this important work. So thank you again to Supervisor Fletcher and Supervisor Vargas for this opportunity.
Thank you so much for those wonderful words. Next, the tribal chairwoman of the Manzanita Band of the Kumeyaay Nation. We're thrilled to have with us Angela Elliott Santos.
Thank you, Supervisor Fletcher. I'm very honored to be here. Hauka Mahanmanweya. I guess I'll just start with these words that you're all speaking are the words that my ancestors longed to hear. The dehumanization of my people after having lived on this land, this beautiful land in San Diego County for 12,000 years, proven by science, but since time immemorial, as told to us by our ancestors. It's wonderful to be included in this and to hear these words. I wish that the ancestors could hear them. Being from a group of people, well, all the Indians in California had a bounty put on their heads by the first governor of California. That is a true reality. It was on the books. It was after the state of California became the state of California. That bounty was paid on our people's heads, and that has done so much damage. The intergenerational traumas that my people have suffered, although we're very resilient to still be here, to still have language, to still have cultural songs and ceremonies, after seeing our kids taken away, sent to boarding schools, had their language taken from them, their hair cut, separated from their parents. Everything that happened to us fit all the definitions of genocide, and it has had lasting effects on my people. We suffer now. I have a picture, and I should have brought it, of some Indian ladies at the first Cabrillo Festival. And underneath the picture, it says that these ladies were all over 100 years old. It says the oldest Kumeyaay in San Diego. Every one of those ladies were standing straight and tall and over 100 years old. Today, diabetes runs rampant on our reservations. After having been free and proud, we were pinned up on land that wouldn't sustain one family out in the mountains, 4,200 feet up at Manzanita. So we see the lasting effects. Some of our people are lucky to make it to 50 years old now, when we used to live to be 100. The dehumanization of our people is unending. Even today, as a tribe out in an area where we have a very healthy wind resource out here that we want to share with everyone else, we don't get to collect taxes on a project that's on our land. We don't get to have the project. We have to lease it because the government has provided production tax credits for big companies to own our wind project. So it's never ending for us. Out of everyone, we always feel that we have no right to have religion or, as I said, to just be humans. And so when I look at those effects, they're daily. When I look at our young people, they're angry. But to hear the words that Governor Newsom has uttered during his Truth and Healing, to hear the words that you spoke today, Supervisor Fletcher, it's unbelievable, and we're happy to be a part of it. but it's real. And to hear you say that there's going to be actions behind these words, that's what our hearts need to hear, because sometimes these words have been spoken in the past, but nothing ever came from them. And so we see our children passing on from all the opioid crisis that's going on because they still haven't been recognized. The truth of what happened to our people has never been recognized before these days. And so it just continues on and on. And so we want to be part of this. We support what you're doing. You know, even here, like I said, the tribe doesn't get to enjoy the American dream. We don't get to have business like other people. Or if we petition to put land into trust for new housing because our reservations are industrialized or they are not fit for us to be able to do any type of business or garden or anything. Or for our people, if they don't have good cars, the nearest grocery store to Manzanita is 30 miles away. So if you don't have a good car to get you there every day, you can't buy up good vegetables and fruits to live healthy the way that we used to. You're stuck in this rut. And so, as I said, the suffering that the people have endured, the indigenous people of this state, it felt unending until the last couple of years when we joined the 250th anniversary and raised our flag at the Presidio, an acknowledgement that we're still here and we're still strong. So I can't thank you enough for all of these things, and this tribe and all the other tribes in San Diego County. We support this and want to be part of it, and not just for ourselves, for everyone, because out here in the backcountry where we live, a lot of people suffer, a lot of people are forgotten. So I thank you very much and applaud all your efforts.
Thank you so much for those powerful words. Next up, we're going to hear from the Director of Operations for Pillars of the Community, someone I've spent time with, I've listened, I've learned, and I certainly rely on a lot. Layla, thank you so much for joining us. The virtual floor is all yours.
Thank you so much, and thank you, Angela, for your words. They really impacted me. I'm a Black woman, as you can see, and I come from a people who our original interactions with the police were through slave patrols in the South, and how this has evolved into our police departments in San Diego. And at Pillars of the Community, we work a police accountability program with community members because the police departments and the judicial system, law enforcement, and our criminal and justice system as a whole has evolved into maintaining Jim Crow, maintaining inequities, and maintaining keeping certain people in a certain class. And when we look at that in my community, just because I exist where I live in Encanto, if I'm with someone and it's a domino effect, I could be labeled a gang member without ever having committed a crime. And what this means is that at any time, if I have any interaction with the criminal justice system, I can be given a more severe sentence than anyone else. And how that has played out in San Diego is Black and brown people their sentences are far longer than others for the same exact offense. And we have young Black and brown men, young men who are in prisons for misdemeanors because of some of our gang enhancement language and laws and policies. In my community, the gang unit does not have to do RIP of data, so they don't have to show racial profiling in their data. And if you come to Encanto and you go to Imperial Avenue, you will see Black and brown men on the hoods of cars, handcuffed, being looked at, being investigated, their rights, passengers, people in the back seat, and the driver, no one has rights. And our constitutional rights are trampled upon. And this is the interaction that we have with the criminal justice system, where I have a Latino woman who has 4 sisters, and we have a district attorney who tells them they have to choose a misdemeanor, or they're going to prosecute their sister to the highest degree, or they cannot and their sister can go to prison. That's not justice, choosing a misdemeanor, closing your eyes and picking one. But that's the way that the criminal justice system interacts with our people. It's about convictions, and the collateral damage that comes after that affects us in housing. It affects us in employment. It affects us at any juncture in our lives after these interactions, after this inequality, after the Black codes that are mandated in our community are still held. And those are the issues that we're having. We're having an issue where what Nathan and what Nora are doing, what the Board of Supervisors is doing, is acknowledging that these inequities do exist, and acknowledging, because of these inequities, what we have in our communities. And we're talking about opiate abuse, drug abuse, hopelessness, poverty. All of these things come out of these systemic inequities that we hold on to. And I want to thank you both for being brave, because a lot of people are not going to want to hear what you're saying. And a lot of people like to live in a place where they don't have to see what other people deal with. And let's take the wool from their eyes. And we are here with you. And I want to thank everyone else on this panel. We have a lot of work to do, but we are brave people and we're ready.
Thank you so much. Thank you so much, Layla. Next up, Executive Director of the Environmental Health Coalition, Diane Takvorian. So many of these issues have spillovers into so many different areas: economic justice, criminal justice reform, land use, housing. I mean, it really cuts across everything. But an area that I've spent a lot of time on, both as an Air Resources Board member and Air Pollution Control District in the area, Diane has dedicated her life towards are issues of environmental justice, which have tremendous racial implications. So Diane, thank you for being here with us. The floor is yours.
Thank you so much, Chair Fletcher, and congratulations to you and Vice Chair Vargas for your election to these really important leadership roles. I'm thrilled to be here today to express Environmental Health Coalition's strong support for this proposal to declare racism as a public health crisis. And I'm truly honored to be here with these racial justice leaders who are speaking their truths and being heard for the first time in a very long time by our new county leaders. So thank you all for that. In so many ways, intentional and unintentional racist policies have shortened the lives of people of color and significantly reduced the quality of those lives. Today, I want to speak to the impacts of environmental racism, which is systemically embedded in our culture and in our government. As far back as 1986, the groundbreaking Toxic Waste and Race Report found that 60% of Black and Brown Americans live in communities with uncontrolled toxic waste sites. Hundreds more reports across the country confirm the disproportionate impact of pollution on communities of color, and San Diego was no exception. We have the evidence of the same patterns of excessive pollution in our communities of color. Discriminatory land use decisions create neighborhoods where lives are at risk every day. Homes and schools are allowed to be situated right next to huge warehouses of toxic chemicals. Children have to navigate their path to school, dodging semi-trucks, and they're forced to play in parks jammed between polluting industries. So it's no surprise that still today, zip code is still the most potent predictor of health. In San Diego, environmental justice communities are some of the most unhealthy in the state. So what does that mean in real terms for resident health? Well, it means more asthma. Children in these neighborhoods have 5 times more asthma hospitalizations than children, let's say, in La Jolla. Shorter lives. They have residents in these communities live up to 16 years less than those in the healthiest census tracts. And now more COVID-19. Coronavirus is disproportionately affecting Black and Brown communities, especially in areas with serious air pollution. A Harvard study found that just a small increase in air pollution results in an 8% increase in death for residents in polluted neighborhoods. In San Diego, Latinos account for 34% of the population, but nearly 65% of the COVID cases. So given what we know, non-action is explicitly racist. In the face of data that clearly shows people of color suffering more illnesses and impacts from climate and environmental pollution, when we don't act, we say we don't care. The county has the authority to act over hazardous materials, the climate action plan, and public health. Nearly 40 years ago, the County of San Diego enacted the nation's first community right to know law, requiring information about toxic chemicals and their risk to health to be disclosed to workers and the public. Following San Diego County's action, state and national right to know laws were enacted. San Diego led the nation then, and we can do it again now. So I want to thank you, Chair Fletcher and Vice Chair Vargas, for proposing this bold action as a significant step to recognize and address the impacts of racism on public health. And I look forward to working with you both to implement it.
Thank you. Thank you, Diane. Next up, Norma Chavez-Peterson, Executive Director of the American Civil Liberties Union, San Diego and Imperial counties. We've been in a lot of fights on a lot of issues for a number of years, and it is great to be here today with the new board and new majority, and with your continued advocacy and partnerships. So Norma, thank you for supporting this effort and supporting what we're doing once more.
Thank you, Chairman Fletcher, and thank you to my supervisor and dear friend, Vice Chair Nora Vargas. It definitely is a new day in San Diego, and I'm happy to be here. First, I want to also just honor the words of Angela Elliott Santos. They also impacted me deeply, and just want to honor all of our elders and ancestors from this land and the Kumeyaay people. So thank you for being here. Long before COVID-19, the ACLU of San Diego and Imperial counties has fought against discriminatory policies and practices that put people of color at greater risk of substandard healthcare, substandard education, housing insecurity, food insecurity, joblessness, and over-policing. The pandemic raised broader public awareness of these inequities and made them worse. For many of us, we are well aware that they've been existing, but it's raised a broader awareness. With new leadership at the Board of Supervisors that share our values, the people can be certain and ensure that our county government will be courageous, cooperative, inclusive, and accountable in devising comprehensive solutions that lead to a more equitable recovery for us all. But it will be up to all of us to ensure that this happens. Our region is plagued by two lethal pandemics. One is that devastating virus that has caused more than 350,000 deaths across the US and 1,654 lives lost in San Diego County. I want to say that again, 1,654 as of the last report on the county website. Many of them essential workers, elderly, and people with pre-existing conditions from my community, from our communities, predominantly communities of color. I want to make sure that we remember those lives and we honor those lives, not just today, but every single day that we fight to make this county more equitable for all. The other pandemic that's plaguing our region is systemic racism. And systemic racism predates and contributes to COVID-19. It is manifested in the unequal distribution of wealth, power, and life opportunities afforded to people based on skin color or where you live, like Diane said. COVID-19 has pulled back the curtain on acute racial, economic, and other inequities in our society that make people of color more likely to become exposed to the virus, more likely to become seriously ill, and more likely to die. Unlike the novel coronavirus, racism is not new. Racism is so deeply rooted in our culture as to be invisible to white people who have largely benefited from generations of government-sanctioned discrimination that has crippled others, namely people in communities of color, afflicting them with a range of pre-existing conditions that make them uniquely vulnerable to the health and economic impacts of COVID-19. We already heard about the racial disparities in access to healthcare, nutritious food, and affordable housing, racial disparities in who holds essential jobs, and racial disparities in policing and incarceration are among the many factors that make people of color more susceptible to the devastating impacts of COVID-19. The ACLU and our partners will remain vigilant to ensure impacts of COVID-19 on the county's most vulnerable communities is thoroughly assessed, and that the government's efforts are inclusive of our region's vulnerable communities, including Latino, Black, Filipino, other API communities, our Indigenous siblings, unhoused individuals, and the youth and adults who are incarcerated in all carceral settings, including detention facilities. Recognizing racism as a public health crisis affecting all of San Diego County is essential to our region's full and equitable recovery from this devastating pandemic. We must dismantle the interwoven systems of laws, policies, and customs that operate collectively to ensure that the subordinate, vulnerable status of people in communities of color. The people of San Diego County are best served by COVID-19 response and recovery efforts that are grounded in science, driven by data, and centered on the needs and voices of communities that are disproportionately impacted. So I am so glad to be here today because we know that that has not been the case in the last year. I'm encouraged by the vision and leadership demonstrated by you, Chairman Fletcher and Vice Chairwoman Vargas, to address the needs of our county's high-risk populations. The Board of Supervisors must identify and implement solutions to eliminate systemic inequality. And I urge the rest of the Board of Supervisors not to close their eyes to the long-standing systemic oppression that has made certain populations more vulnerable to the impacts of COVID-19, and to support these actions at your January 12th meeting. I urge the board to listen to the voices, many of the voices that are here, but so many of the other voices that we haven't heard yet, of historically and systemically marginalized groups, to ensure that we, the people, really, truly means all of us. Thank you very much, and I look forward to continuing in this fight together.
Thank you so much. Thank you, Norma, for joining us. Next up, we have another longtime advocate leader, someone who's worked on the transformation of county government for a long time. We're thrilled to have the Executive Director of the Center on Policy Initiatives, Dr. Kira Green, with us. Dr. Green.
Good afternoon. I am honored to be here today, and I'm going to get through this statement because I have so many feelings and this moment of being an American and San Diegan. I am Dr. Kira Green. I use she, her pronouns. I'm here today as the Executive Director of the Center on Policy Initiatives to support the resolution being brought forward by Supervisors Fletcher and Vargas to declare racism a public health crisis in San Diego County. Being a target of racism is a risk factor for every negative outcome, including health outcomes. And being a racist actor is the result of a diseased mindset. It is the perspective of individuals and groups who reject some of the most basic tenets of human dignity, the principles that we hold, that we should respect one another and treat one another as we want to be treated. This illness, racism, that harms its host and its targets is a public health crisis all over this country. Addressing racism and inequality in San Diego County won't end it in this country, but we can't bring about the end of racism and inequality without addressing it in this county. Unequal pay and income inequality means that people of color have less access to healthcare and healthy and safe housing, leading to all kinds of negative outcomes. In fact, in San Diego, half of all Black households were paid less than $56,000, and half of all Latinx households were paid less than $61,000. In contrast, half of all white households made more than $89,000. Years of racism and racist policies have created a wealth gap between white families and Black and Latinx families. Wealth leads to financial security and economic opportunity passed on through generations. Historical inequality and the resulting inequities of wealth, income, and health cause intergenerational poverty. That is why in San Diego County, more than 1 in 4 Black children, nearly 1 in 5 Latinx youth, but only 1 in 10 white children are growing up in poverty. These outcomes are the result of both intentional action by some people and by unintentional action or by inaction from the vast majority. In terms of intentional racist actions, San Diego County has a long history of white supremacist organizing and activity. White supremacists have been able to terrorize people of color and have discouraged other people of color from moving here. But people's beliefs about the inferiority of people of color have also been able to move their values into action through their positions of power in government and in the private sector. That is why this region has long denied people of color access to loans, homes, leadership positions, and the good jobs that have made San Diego one of the best places to live if you are white. We know that these dynamics influence even those who do not see themselves as white supremacists. These dynamics of discrimination seep into how many of us think about who is an ideal tenant or a peaceful and law-abiding neighbor. But as much as anything else, institutionalized racism and other forms of discrimination shape our workplaces. They shape who we seek out to employ and to give access to opportunities for advancement. As a result, San Diego County is a place where people, mostly those who are not Black, Indigenous, or other people of color, get rich, or at least comfortable, off the labor, the risk, and the suffering of working people, especially working Black, Indigenous, and other people of color. From the start of this country and to this day, the most dangerous, the least desirable, and the lowest paid jobs are usually assigned to people of color. And often, racism is what causes or keeps these jobs dangerous and low paid, and therefore undesirable. Workplace racism is why we are seeing higher rates of COVID-19 infection and death among people of color. But racism and inequality are also the causes of higher rates of heart disease, mental illness, and other diseases created by the everyday stress of racist treatment and exclusion. The concentration of poverty and inequality and ill health creates the pressure for people of color to go to work and to work in public-facing jobs in retail, in grocery stores, and delivery services, and even in the delivery of county services, even when they are denied access to protective equipment, safe practices, or a fair wage. Too often, San Diegans of color have to submit to racism and the risk of early death in their workplace conditions, or face immediate threats to their ability to pay their bills and to survive. That is why racism, including workplace-related racism, is a public health crisis. If we want to end racism and inequality, we have to respect Black people's lives. We have to respect the dignity of Indigenous people. We have to protect our Latinx siblings, and we have to honor that Asian and Pacific Islander residents are part of the fabric of this community. Our labor and our lives are intertwined, and both our labor and our lives matter. Thank you, Supervisors Vargas and Fletcher, for this opportunity to speak on and work together on this critical issue. Thank you.
Thank you, Dr. Green, for the wonderful remarks, and in particular calling out the economic justice aspect of racism and what we deal with. Our final speaker today, Executive Director of San Diego Pride, Fernando Lopez. They have been a great leader, an advocate, and champion for so many of these important issues. We've worked collaboratively on a number of things to date here at the county, and we look forward to continuing that partnership. Fernando, thank you for joining us. Floor is yours.
Thank you, Supervisor Chair Fletcher, and thank you to Nora Vargas. I'm excited for all the new leadership of the county. The LGBT community has made incredible strides towards equality in our county, the state, and our country. But the hard reality is that the LGBTQ community is still not treated equally under the law, and that our lived experience often does not reflect the policy gains that we've made, and that our community's progress has disproportionately left behind Black, Latino, Chicano, Indigenous, and Asian communities. By nearly every single metric we can measure, LGBTQ communities and BIPOC communities suffer through diminished quality of life outcomes, not because there's some sort of inherent failure in who we are as individuals, but rather that our society in many ways was designed, as you've heard, with inherent structural racism, xenophobia, sexism, transphobia, and homophobia. Meaning that those of us who were born into the intersection of these lived experiences have steeper obstacles to overcome and fewer social networks of support that are actually designed to uplift us, with many designed to suppress us. Young lesbian, gay, bisexual, transgender, queer, and two-spirit people experience homophobia and transphobia at a very early age, in school, from fellow students, and even from faculty, or even from within their own families or communities of faith. These issues alone lead to higher rates of absenteeism, diminished mental health outcomes, suicidal ideation, higher rates of self-medication, suicidal ideation, and homelessness. When young LGBTQ people are also facing the compounded threat, whether direct or systemic, of racism, our lived experiences and outcomes fare far worse. And so it should become clear to everyone that we are failing LGBTQ youth of color, and that failure ripples across a lifetime. 40% of all homeless youth are LGBT identified, leading to about 30% of all adults experiencing homelessness are LGBTQ. If you're Black and transgender and a woman, more than half of you will experience homelessness in your lifetime. COVID-19 has illuminated the economic inequality across our country. And while 45% of American households have experienced some sort of severe financial hardship due to the COVID-19 pandemic, that number jumps to 62% for LGBTQ households. When you look at LGBTQ Latino households, that's 70%. And for Black LGBTQ households, 95% of Black LGBTQ households have faced serious financial hardship. We are failing LGBTQ communities of color. For 4 decades, as we fought against HIV, another pandemic, and we continue to fight against the spread of HIV, we took pride in watching new infection rates drop. But as we realized that those numbers were dropping, the percentage of those cases that were in communities of color rose every single year. And the most impacted in our region are Black women and young Latino men. We continue to fail along these lines of LGBTQ communities of color. I could go on and on about the intersectional disparities as they pertain to employment, sexual assault, domestic violence, seniors, healthcare, immigrants, asylum seekers, mass incarceration, police brutality, military veterans, and beyond. But the point is that as we combat homophobia and transphobia, we must also address racism. And as we combat racism as a public health crisis, we must also address homophobia and transphobia. It is not that those of us at the intersection of lived experiences are broken. It is that our systems were designed this way, and they need to be reimagined. And I'm honored to be here with all of you today and our new leadership here in the city, county, state, and country to see us combat these issues head on. Thank you.
Thank you so much, Fernando. Thank you to everyone for joining us. In closing, Supervisor Vargas and myself have outlined a transformative policy and resolution to not only declare racism a public health crisis in San Diego County, but begin the process of changing our operations, our culture, our data to align with addressing historic issues of equity, both in health, in environment, in economics, in land use, in public safety, in all of the various aspects of county government. We are hopeful that the Board of Supervisors will adopt it on Tuesday. And at this point, Supervisor Vargas and I, who are members of the community who are here, are available for questions from members of the media if there are any.
Hi, good afternoon. Thank you so much for giving us a moment to talk. This is Cassie Carlisle with ABC 10. I understand that people were saying, you know, this is a new board and maybe that's why this has come to light now. There are several agencies throughout California and across the country that have declared this a public health emergency earlier in the pandemic around June. I was curious what took us so long to catch up to this issue that's been around for so many years.
Cassie, I'll take that first, and then I'll kick it to Supervisor Vargas, who's a new member who can speak to what it's like to be here new. You know, over the last 2 years, I think that we made progress, but the composition of the board was very different. We made progress in creating an Office of Equity and Racial Justice, progress in bringing back the Human Relations Commission, progress in issues around the Citizens Law Enforcement Review Board, progress in COVID response around citing testing and other types of things in communities that have been most impacted, progress with translation services in a number of areas. But there is so much work that was left to be done. And I think the reality is we have a fundamentally different board today than we had last week. And I think that this board gives us fundamentally different opportunities to advance more aggressively a progressive agenda. And I'm excited about my colleagues and excited about the board. And I'll kick it to Supervisor Vargas, who I'm thrilled to have as my partner and ally right alongside. I'm going to try to do my best to keep up with her as she goes. But I just think it's a fundamentally different board today than it was 4 days ago.
Thank you, Chair. And I would add that for many of us, we've been fighting health inequities and disparities in our communities for decades. And we were waiting for this moment. And I think as Ms. Angela so eloquently said it, I think and everyone else on here today, we've been waiting for the moment where we can begin to have this transformational change so that healing can begin in our communities. It's so critical and it's so important. And when I was out in our communities asking for the support, what I heard time and time again is we need to change county government from the inside to make sure that our communities have access to the services and the resources that are rightfully theirs. And so I think by bringing this resolution forward to the floor next week, and urging all of you to contact your supervisors as well, and and encourage them to support this resolution, is only the beginning of us working together. And I think some of my good friends on here said this earlier today, right? Creating a resolution is one thing, but putting teeth to the resolution and really doing the work is what we're here for today. We can't just stand up and have press releases and do announcements about how frustrated we are with things, with the way things are. We have to make transformational change, and this is the beginning. So I am proud to be Chair Fletcher's partner in this process, and I'm looking forward to the changes that we will make and hold us accountable. Hold us accountable, because that's what we're here for, and we're going to make sure that our government gets back to our communities, because this is a county for all of us, not just some of us.
Thank you
Thank you,
so much.
Nora.
Can I ask a question, please?
Of course. Thank you, Cassie.
Thank you, Nathan. Thank you, Nora. One of the things about this racism, and I think it's very important that you guys are taking this in a way that is supposed to be taken a long time ago. But the vaccines, do you think, and are you prepared to try to fight this issue of being so slow in the county, especially for underprivileged people that is supposed to be getting the vaccines now, but they're not? As a team, as the county health is trying to cope up with this, and the same as the governor, but how difficult is that going to be for unprivileged people that is supposed to be they are on the first tier to receive the vaccine, which there are a lot of them still haven't received it?
Yeah, thank you, Carlos, for the question. We're still in the early stages of the vaccine, but look, I'm frustrated with the structure of vaccine distribution. You have a whole bunch of entities that are getting it direct. Healthcare systems get it direct. CVS gets it direct for long-term care facilities, DOD, VA. And at the county, we have kind of an air traffic controller role, trying to coordinate all of these entities. With what we get, we will step forward and lead to address issues of equity, to make sure folks who don't have access to traditional healthcare systems have access to a vaccine. And we will make sure, with what's in our control, that everyone can get it regardless of their immigration status or any other type of issue. We will work to address issues of equity. But I think that the process as a whole, with having all of these different entities run their own programs, is one that has the potential to lead to confusion. So we're going to fight. We're going to try and make it better. And with what the County of San Diego controls and the doses we get, we will ensure that we are addressing issues of equity and getting those to the most needed and most impactful communities.
And I would add to that, Carlos, that I think that fundamentally, I think this board understands the importance of the community partnerships, of those trusted providers that are on the ground, that have been able to provide, the testing and the strong commitment of making sure that people have what they get through COVID. It hasn't been perfect, but I think the county has heard loud and clear that this is a priority for us. And so community and our community partners are going to be integral for our communities to be able to have access to the vaccine. And it's going to be a priority for us as well.
Thank you.
Thank you, Carlos. Do we have any other members of the media that have a question?
Yeah, this is Taryn Mento with KPBS. I raised my hand. I'm not sure exactly what the protocol is here, but
I got you. Just unmute yourself and talk. You got it.
Yeah. So I do have two questions, and because a question just came about the vaccines, I'm going to ask that one first. And I'm going to put this question to the rest of the panelists, not the supervisors. Do you feel that the communities that you represent and stand up for, there is clear communication when those communities would be getting the vaccine? Is that clear to all of you?
No.
Does that, I guess maybe it's a better question to say, does anyone feel like it is clear? Well, thank you. The other question I have is, and feel free, any of you, to follow up with me on that offline if we'd like to talk further. teammento@kpbs.org is my email. But the other question I have is, and I understand that this issue is not going to be healed overnight. We know that that's a long road ahead, but is there an example? And I know the beginning of this is to gain stakeholder input and look to how to approach this, but is there an example of one of those teeth, that policy that can be implemented that would actually create change? Can we be specific about something?
Sure, Taryn, I'm happy to take that one. The first is creating an intentional policy to ensure community input is included to identify county policies and practices that lead to or perpetuate racial or ethnic disparities. The second is revising the statement, mission, values, strategic plan for the county. The third is every county policy we adopt is done via a board letter. There are multiple sections of that board letter. You got to address fiscal issues, other types of issues. This will incorporate in every board policy brought forward an equity impact statement to determine how the policy you're adopting is tackling issues around equity. An equity impact statement to address issues of equity. And then a key point is enhanced data collection capacities to identify racial disparities amongst programs. An example of this I would give you is in a recent presentation on Live Well successes. We talked about a countywide modest reduction in one chronic disease. Well, we need to see how that breaks down across all sectors based on race. Because if you had a 8 or 9% decline in a chronic disease amongst a population that already has incredibly great healthcare, but you had a 6% increase, that net is not progress for our region because it is not addressing the underlying issue of equity. And so the data collection component of this for programs and services around health, social, economic, educational, criminal justice, all of those are designed. Again, what we're aiming to do is create a framework through which we can change the culture of the county, how the county thinks, how the county approaches, and provide the vehicles and mechanisms to bring back additional policies to move these and also to be able to hold ourselves accountable to them.
Ethan, can I also add to that?
Of course.
Yeah, I just wanted to add that on the state board that Chairman Fletcher and I serve on, the California Air Resources Board, it's become part of the framework that an environmental justice assessment needs to be made for the rules and reports that are coming forward to our board. And it requires a deep dive into what the impacts are going to be on the communities that are most disproportionately impacted by air pollution. And I have to say that I think it's made a difference. Just that information alone allows the board to evaluate and act on those policies in a different way than they would have done previously. So I think just the information alone starts to make a difference. And then as you implement these policies and enact policies that directly serve and reduce the impacts on those communities, that's what follows from that. So I think it's a good example and one that both of us are happy to be part of implementing. And I think we can use the benefits of that as we go forward with these policies. And I want to say it's now part of the routine that there's interpretation at all meetings, that there are community meetings that happen at times when community members can be there, that materials are translated into different languages. So those are the kinds of things that should become routine. We should just expect that those will happen so that our communities have access to these policies and to these decision-making opportunities.
Great, thank you.
Thank you, Diane. Any other questions?
Yes, this is Joanne Fields from the Filipino Press, and that it is very visible the lack of Filipino or Asian Pacific Islanders on the panel. The resolution has no mention of Filipinos or API. Translation materials are only in English and Spanish. What efforts are to make sure that all communities of color are included in not just, well, I mean, for policy development, yes, but for outreach, again, with COVID, to make sure that we have contact tracers and language access. What efforts are you, I did speak with Paola, and I know that there will possibly be amendments to the resolution, but how was that overlooked in the
Sure.
presentation?
Yeah, we will be changing and amending the board letter to make sure our API and Filipino communities are included. It was not our intent. We will ensure this doesn't happen again, and the board letter will be changed to make sure that those communities are represented as well.
Okay, because this did happen again when the reintroduction of the Human Relations Commission. I know that
Okay.
my colleagues in the APAC. So thank you for recognizing it and to make change.
Okay, thank you. The API community is represented on the Human Relations Commission, but they need to be included in this board letter and everything else. Thank you. All right, any other questions? All right, thank you all so much for joining us today, and we look forward to hearing all of your voices on Tuesday as well. Thank you.
Thank you.
Thank you.